Hello everyone, and let's talk about a typical call day or a day in life for an internal medicine resident. Now, a call day usually means you're on call, right? You are responsible for the admits. You can also be responsible for code blue pager. That means if there's any cardiac arrest in hospital, senior is usually the team leader and the intern is usually the chest compressor. And then you're also responsible for any cross cover situations after taking the sign out from your other team. That's at 4 p.m. So I'm going to talk about typical call day at my residency program, and this varies according to the institution. So our call day starts at 7 a.m. and runs until 8 p.m. Okay, so usually go in at 7 a.m. a little early usually, and then you take the sign out from your night team and you take the sign out for your team's patient, that what happened overnight. Was there anything acute? Did the patient fall? Did the patient get confused? Or was the patient short of breath? Was the patient having chest pain? So you take the sign out from the night team, that what was happening and what was done and what should I be aware of as the morning team person. So that's what you do when you take the sign out. And you take the sign out for your old patient, and if there are any new patients, you also take the sign out for the new patients as well. So that's typically the sign out time, 7 a.m. to 7:15, and then from 7:15, depending on what role you are in, like for example, if you're an intern or a senior resident, then typically you have to decide on what role. If you're an intern, you then directly focus on your patient and start chart reviewing and looking at the vitals and labs. As a senior, I usually triage the patient, that I quickly look at the vital signs. I quickly also keep in mind what was signed out to me by night resident, if there are any issues which needs immediate attention. And then of course you look at the labs and vitals and see which patients need immediate attention. So that's how you do your own little mini chart review and triage the patient. So usually you start chart reviewing around 7:15, and this can run from around 7:15 a.m. to morning 8:30 a.m. That's when you do chart reviewing. You call the nurse to confirm what happened overnight, or you hear the nurse's concerns, because they are the one who are really in proximity to the patient, so they know what's actually happening. Then you place appropriate orders or any preliminary thing like replace potassiums or anything which you see from the chart review. And then in the morning 8:30 a.m. that's when you start rounding by yourself physically. So you go to each patient's room and then you do your own little history taking again, and how was your night, and you do your own physical exam or quick ultrasound exam if you have, if indicated, and then you again can change the orders or put in the new orders if applicable, and then you can talk again to the nurse to communicate the plan. You can talk to the case manager, you can talk to the social worker at the same time. The reason for case manager and social worker is usually about the disposition, like for example, does this patient need assisted living facility, skilled nursing facility, or if this patient is going home, do we have a ride? So quickly you can figure out those things when you're rounding on your own, and then you come back to your room around 9 or 9:30, and that's when you'll have your attending, and then you start rounding with your attending. Now attendings, depending on their style, usually they would have either table round, or they can directly go with the bedside round. Usually first day, when every one is new in the team, we usually do table rounds, so to get acquainted with the patients and the history part, and then we go to the bedside. If we already know the patient beforehand, then you can start again with the bedside rounds. So that usually takes place around 9:30 to around noon, the rounds with the attending. So you again go in with the attending and see the patient and examine the patient again. So that's until noon. And in noon, around noon time, around 12:15 to 1, we would have noon lectures. Those could be morning reports, inpatient morning report, outpatient morning report, board review lectures, faculty lectures, ICU presentation. You can have morbidity and mortality conferences. So you would have all those conferences in the noon time. You can even have some guest lectures and some wellness activity in that time. Then around 1:15 you go back to your room and finish off pending tasks, whether you are left for calling consults or you run the list again to see if you are missing anything, make sure you placed all the orders and make sure things are happening the way you want. And that typically lasts from 1:15 to 4. And meanwhile, you also can catch up on your documentation and notes. You want to dictate your note, you can quickly start dictating and start saving those documentation to finish off those things. So that happens until 4. At 4, since you're on call, you take the sign out from remaining teams. So all the team comes to you around 4, and then you take the sign out for all the teams. And then after they sign out, you are responsible for all the cross covers. So whatever happens after the sign out, you'll be responsible for the cross covers. Different institutions have the different policies about cross cover, but at our institution, after 5 to 8, that means you are responsible for everything, whatever happens to that patient. So that's usually the cross cover time. In that time, if anything happens, whether you're called for admit, whether there's a code blue, whether there's a rapid response, you are supposed to go there and attend that. So then in the evening time, you try to catch up on the documentation itself, make sure everything is placed, make sure everyone is stable. That's usually the evening time. And then you address the cross covers because you'll be getting pages from all other teams' patients as well. So that's the evening time. And then finally 8 p.m., right? So the night team would come at 8 p.m. Then you sign out all your team's patient as well as the other team's patient to the night team, and then you hand off everything to the night team. So now night team is responsible for all the patients in the hospital. So that's a typical call day. And once you're done with your call day, the next day is post call day, and after that is short call, and after that is pre-call day. So you are actually on call every 4th day when you're in wards. When you're on nights, you're pretty much on call every night. Nights are usually 2 weeks long, whether floor nights or ICU nights. So that's typically a day in life for internal medicine residency. I hope you got a glimpse of how residency is like, and I hope you found that helpful. If you have any other insights you want to share or anything interesting you want to share, please share below in the comments, and please like, subscribe, and share. Thank you.